to you by Holy Name Medical Center in Teaneck, New Jersey.
We're pleased to welcome Barbara Blackwell, who is Director, School of Nursing, Holy Name Medical Center. Good to see you, Barbara.
Good to meet you.
The nursing profession has changed dramatically. I was going to say in the last 10 years. I'm thinking in the last few, right?
Oh, well, yes, very much so.
Describe
really has changed. There's so much more technology. There's so much more pressure, with the regulations and everything that's coming down at this point. Nurses have to do a lot, and they have to learn very quickly, and they have to be able to think on their feet. And so it really has changed a lot.
You know, go back to when you decided to be a nurse.
Oh, we're going way
no,
back.
It's not that way back. Let me ask you this. When you decided, what was the key?
I think the key was the idea, and I hate to be, trite from what people say, but I did want to help people. And
That's not trite.
And I did want to do something where I had a personal connection with people. And I felt that nursing would give me that. So, because I actually, which is, I think, rather interesting, I actually was going to be pre-med. And I made a conscious decision to become a nurse.
In your mind, the direct access to patients for nurses, is it more important than ever before post-Affordable Care Act?
Absolutely.
Talk
I
about
think that, even with the influx of technology and everything that's happened, that touch, we cannot lose that touch and that connection that we get with people. They call it now high tech, but we also have to be high touch. We have to have the patient.
Can you be both?
Yes, you can.
Just give me an example. I'll put you on the spot. Give me an example. People say, hey, listen, technology today, so much of it drives healthcare. You don't need as much of the human touch because you can move things quickly through technology. You say...
But that personhood, who we are, there's a person in that bed, and that person is a mother, a father, a son, a daughter. That you can't lose that person in all the technology and everything. You have to let that person know that they count and that they're important. And I think that that is even far more important than the technology. The technology gives us information, but I believe that it's the relationship that we make with people and with that patient that helps to move that patient toward health or toward whatever end that there might be.
As you talk about this, there's been a lot of research on the concept of empathy. A recent article in the New York Times talked about a study that has been done on empathy and whether A, you can teach it, B, whether it's ingrained in certain people. The concept of empathy for nurses, do you think most of those in the School of Nursing have it going in, or it has to be taught and honed as they are in the school and ultimately out there dealing with patients? Loaded question, I know.
Oh, I think it's both, honestly. I think there's some who come in with that natural feeling, that empathy and that caring, but I think it can also be taught to a certain extent. The first thing I tell people when they come to our open houses is that we are a small school with a big heart. And I think that's of the school and of the medical center. We have a big heart. I feel like once you come into Holy Name, whichever entrance you come in, you become part of Holy Name family. And I sincerely believe that. And I'm lucky that my faculty believe it, and that's something that we really try to inculcate in all of our students. And that starts the touch. I believe that that starts with the education. And I sincerely believe education changes lives. And that's always been my personal mission. Education changes lives.
Do you believe there's actually a culture? We've talked about this. Mike Maron, your CEO, and I have had a lot of conversations about this. And the work that Holy Name has been doing in Haiti is not insignificant and not by accident, right? How much of the culture and the mission of Holy Name is driven by that mission?
I believe we live our mission. We live it through education. We live it in the medical center. It becomes a part of who we are. And I don't believe that you can come into Holy Name and not learn that and not become part of it. And I think it's just something that is just so ingrained in us. And I'm not a Holy Name grad. I came to Holy Name from a hospital in the city, but it's something that I sincerely believe in. And I believe that it moves. It lives, it breathes, it moves through everything that's the hospital and that's the school.
So talk about this. Talk about post-Affordable Care Act. Talk about the concept that nurses are expected to do more than ever before. And you told our producers that nurses need to be more, quote unquote, entrepreneurial. You use that expression. And I'm thinking, entrepreneurial, what, start a business? But that's not what you mean. No. Operationalize the concept of being entrepreneurial for a nurse. I'm not sure what that means.
I think that nurses have to be able to be self-directed, to be advocates, to be all that. When I first came into nursing, it was, I can't say it was just about patient care, but it was about patient care, doing this and doing that. But our minds have to be much broader than that now, because we have to be very well educated in the changes that are going on in healthcare. And I don't mean just as administrators at the bedside. We have to know what's going on. We have to know what affects our practice, and we have to become very much involved in that. We have to be educated to be involved in that. And that's, again, something that we try to teach our students from day one.
Is that entrepreneurial?
Well, I think it's part of that piece of it, because, you know, that really is part of the business piece of it. You know, you have to be able to move forward. You have to be able to be part of the whole infrastructure that is healthcare, that is nursing, that is the medical center, that's where you work. You have to be involved. And it used to be, okay, I go to work and I go home.
Not enough.
Can't be that anymore.
Do you have to be a leader?
You have to be a leader.
So let me ask you about that.
I believe you have to be a leader at the bedside. You have to be a leader as a student. Our students, we have a whole student council that's very much involved in the school. You have to learn how to be a leader, and you have to be a leader for your patient also.
Back up. You have to learn to be a leader, so I'm going to ask you. You've learned to be a leader over a few years as a nurse,
yes,
and as a nurse leader. What would you say the biggest lesson you learned about leadership is?
I believe that leadership can be caring. I really do, and I think that
can
that's
be or must be.
I think it must be caring also. I think that you do more when you inspire, and that you get more people to follow you as you inspire. I believe that leadership has to be something that changes as time changes.
How about someone says, this is my approach to leadership, this is what I do, I tell people exactly what needs to be done, and I don't change for anyone. Good leader?
No, because I think that then you're going to, I believe that there has to be inspiration. There has to be something that people have to understand what your mission is, what your purpose is, and they have to buy in. And then you get to have sort of a groundswell, and people start to move towards you and with you. You know, I think that you get more from inspiration sometimes than you get from perspiration almost. Yeah. You know, I think that. And I have to say, I think of Mike, because we see his vision. We understand Mike Maron, yes. And we all call him Mike. We all understand what his vision is for our institution. He makes that very clear. So you have to have that groundswell so that everyone's moving in the same direction and that everybody takes it to heart, so to speak, and that they give their all to it and all to the mission. And I think that's how we have been so successful in Holy Name.
And just to fully disclose something, we were actually, our production team, with our executive producer, Jen Eichlin, is going to be heading to Haiti at some point in the next several months to, without going into a lot of detail, you can go on your website to find out the folks at Holy Name are doing a lot of work in Haiti for a hospital that's been dealing with the suffering in Haiti for a long time, and our crew is going to be going there and documenting some of that suffering and also some of the important work that's being done to help the people of Haiti. In 2016, we'll be going there. So listen, I want to thank you for joining us and not just talking about the future of nursing, but about leadership and why nurses are so important in this changing world of healthcare.
Thanks
so much. Appreciate it.
Thank you very much.
Seeing science in action makes students realize they can learn.
What is that word now called? Elizabeth.
With the right tools, it's easy to motivate students.
Students need to know science to succeed in the global economy.
That's why NJA established the Center for Teaching and Learning.
To give teachers the training to make science come alive and to keep New Jersey schools among the best in the nation.
That's why we are so proud
to teach in New Jersey's public schools.
The preceding program has been a production of the Caucus Educational Corporation. Also brought to you by the New Jersey Education Association, New Jersey Sharing Network, and by NJ Best, New Jersey's 529 College Savings Plan.